Welcome to CrisisReady's monthly DMDN seminar series, co-hosted with the World Bank's GFDRR. Hopefully acronyms don't trigger you. CrisisReady is a research response platform at Harvard and Direct Relief committed to advancing data-driven decision-making in disasters. Today, we present some of our work in California that builds on our call for better data access, data literacy, and data preparedness in disasters. We have a very exciting panel lined up for our conversation today, where we will talk about the need for leveraging novel data streams to improve disaster preparedness and response. Modern-day disasters result in power outages and evacuations. The loss of infrastructure, including to healthcare facilities, contributes to prolonged impact on morbidity and mortality, as we have repeatedly seen in the United States. What we would like to do today is walk you through some of our work over the last several months. This is a short clip that demonstrates a data visualization tool that'll help communities and responders map where the most vulnerable are, where they move to during evacuations, and what services are needed to line up as these populations move. The tool is a result of a wide collaboration of academics, humanitarian aid agencies, representativeness of California's many state health and professional agencies, including CDPH, Cal OES, CCLHO, CDC, FEMA, and others. We thank our wonderful collaborators at Statement Design as well for translating the shared vision so elegantly. It's my pleasure to introduce a panel to you, which I will co-host with Andrew Schroeder, co-director of CrisisReady and vice president at Direct Relief, Professor Joan Casey from the Mailman School of Public Health at Columbia University, Denise Everhart, who is the Division Disaster Executive at the Pacific Division of the American Red Cross, Eric Howard, a geospatial data scientist and California Governor's Office for Emergency Services, Cal OES, and Dr. Eric Sergenko from Mariposa County, HHS. I believe we're still waiting for Eric to join us, but we will move on. Bear with me for a second while I pull up the tool. We're really excited to show you this. This has been months and months of work with so much and such generous input from several of you on this call, and we really appreciate it. After this clip, I will invite Andrew to co-lead the panel with me in a discussion with our guests. They will respond to the tool using the demonstration as a primer to really describe how they're thinking about data preparedness in the context of service provision and protection in their respective organizations. The Health System Resilience Mappers data visualization tool that you now see on the screen can be explored from 3 vantage points. Here, we're looking at the Dixie Fire as it engulfs Lake Almanor. The first vantage point is vulnerability, which of course can be defined in multiple and often intersecting ways. Here, we have chosen age over 65 as representative of several types of vulnerabilities, reflecting, for example, the need for medical care, food security, assistance with mobility, dependence on durable medical equipment, for example. There are, of course, other composite indices, including the Healthy Places Index, the Social Vulnerability Index, to name a few. There are other specific kinds of vulnerabilities, as many of you have pointed out, that of immigration status, language barriers. We'll visit the vulnerability tab shortly. The second is the movement tab, which tells us where people are evacuating from, where they're going, and when. These data are currently collated from aggregated anonymized data made available by Meta. Finally, the infrastructure tab helps examine what services are threatened or lost and what is available in the receiving communities. Let's now explore the vulnerability tab. I'm going to zoom in here around the Lake Almanor area. Those of you who are familiar with the region, it's just beautiful, and you get these wonderful views of Mount Lassen as you drive up to Lake Almanor. The table on the left, as you can see, provides insights into the baseline composition of the population at risk, right? So it can select these places that rim the lake as the fire threatens to engulf the area. And we can see here that there are approximately 3,700 people, of which nearly 1/3 are above 65. So, there's the sort of high prevalence of elderly in this area. If we move over to counties, for example, we get additional information. I then get a sense of what the burden of DME users in the county is. So it's about 400 out of the population of 18,000 in that county, for example. Of course, disaggregated line item data on DME users is available locally and can be incorporated here as well. Power outages are another threat, which then heighten the existing vulnerabilities ranging from medical needs to food security imperiled by loss of refrigeration, for example. And then the table on the left allows us to explore the extent of power outages in these various counties in further detail. I'm now going to move over to the second tab, movement. As response agencies, that people will evacuate, but what we want to know is not only where they're going, but possibly also where they should go. This tab provides insight into where people are going in the movement. We can see that people have started evacuating here, right? So I'm going to play this again. And the red pixels indicate where people are moving out from, and blue is where people are moving into. On the table on the left, we can clearly see the population density change in the red areas. It drops below the average. If I select Susanville, which is where we think people will go, you can see the population density rise above baseline, clearly indicating that that's where people are currently evacuating to in the time frame that you see. The question, of course, is then, is Susanville prepared? So let's move over now to the infrastructure tab. I'm going to clear all here and select Chester. What the color schema now tells me is what the driving distance in the areas around Chester is, right? Hovering on these towns around the evacuation zone will provide these driving distances. And this is important because the topography of much of California requires knowledge of road routes as they traverse various mountains and valleys. Now, let's look at what Susanville looks like. It is reachable within an hour from Chester. The question is what is ready and available at Susanville were this population to move towards Susanville. So as you zoom in, you get a sense of what the healthcare infrastructure there looks like. The table on the left tells you what the total bed capacity is usually like. The holy grail here is obviously eventually to have live bed capacity. So we know whether folks can stop in Susanville, whether it's going to be a staging area or you move on. And then this is extendable to shelters as well, and to other response agencies that are trying to move people. We're not even beginning here to then talk about the layers of complexity that arise from smoke plumes and the kinds of additional vulnerabilities that those would create. This tool can be used in multiple ways. During a disaster, it serves as an exploration tool in the hands of an analyst, say, embedded within or outside a response agency or health system, whose job it is to provide succinct, actionable information to decision makers. This Generate Report tab on the right-hand bottom that you see here on the screen allows us to do exactly this. The vantage points that we saw on the dashboard are then replicated when we try to generate the report, the vulnerability movement disaster, and you can scroll directly to the section of the report we're interested in. There's a fair amount of additional information now available at a glance. This report is customizable based on the needs of the end user. And therefore, say that response agencies are primarily interested in understanding movement and want to see that first. we can move movement up on the report, and that's the feature that gets seen. You can also select from the number of solutions you want to see, so it doesn't crowd the report. The report can be saved and shared via hyperlinks, or even better, they can be printed, a hard copy of the PDF that you can walk to the incident commander's post. The second use of this tool, and one which we will begin sharing with interested partners in California in the coming weeks, is that of its role in tabletop exercises in various response agencies during the disaster drills while preparing for the next wildfire season. The tool can be populated with historical fires. For example, we were looking at the Dixie fire. I can toggle and switch to the Caldor fire. And that allows response agencies to work through a variety of permutations to plan and prepare for the protection of our most vulnerable during evacuations and power outages. What I would now like to do is invite Andrew to and the panelists to join in a conversation with us, reflecting on the tool and sharing what the priorities and thinking around data preparedness is in your respective agencies as well.
Thank you, Sajid. That was excellent, and I hope people had a chance to take in a number of the integrated data issues that are brought up in the tool. And I think through conversations that we've had with key disaster response stakeholders through the state over the last several months, we've heard from a lot of you about the need both for understanding the integrated data that Sajid presented and a number of other issues that you're all confronting, which I hope we can get into today, which include the needs of sheltered populations, food security, risk models, and many other things. I believe we're still waiting for one of our participants, but so we may actually modify the agenda here a bit. But I'd like to, in that sense, maybe start with our colleague Denise Everhart from the American Red Cross, who's been dealing with many of these issues for many years from the Red Cross's standpoint around community resilience, making sure that resources are allocated effectively, and in particular, the changing dynamics around evacuation, displacement, and sheltering during wildfires. Denise, I'd like to hear sort of your thoughts on, both what Sajid was just discussing and kind of the problems as you see it as we sort of think about the role of data preparedness in the upcoming season.
So thank you. I'm so happy to be here. The first step in crisis management is understanding the situation. And that is always really our biggest challenge, is to try and quickly figure out what's going on. And right now we have different tools and different methodologies. The Red Cross, we always have our local community responders who can tell us. We've got emergency managers, but that hard data is really hard to get your hands on. Census numbers and see about how many people live in the town, but the ability that I see in this tool to really highlight the areas that are evacuated and get some information about that, who is really evacuated, who is evacuating. That is always, and where are they going? A lot of times in our wildfire areas, people in California and Oregon and Washington and all of the other states that I have, they don't necessarily come to our shelters. A lot of times they go stay with people. They camp in an RV, they do whatever they can, or they'll come to our shelters. We want to get in touch with those folks. And that is always a challenge for us. We want to invite them down to our shelters. That's places where they can get food, a shower, some disaster mental health. Fire departments come down there to give information. So we always worry early on that we don't know where everybody went. The predicting the population movement is always kind of a swag, right? We're doing a bit of a guess, and this tool kind of gives us a better idea. The second thing we're looking at is the vulnerability of the folks leaving. You talked about all those different vulnerable factors. Those go into a social vulnerability score, but this appears to give us a little more fidelity in the data. So a little more of a chance to find out, what does the population of the area look like? I think about the Paradise wildfire and the fact that if we had had that 65 plus data, we probably could have been better prepared in our shelters. When our shelters filled up, all of a sudden we realized that we needed more assistance around access and functional needs, more durable medical equipment. Having a tool that we can all use and look at that kind of gives us that information is really helpful for us. One of the things that we're trying to do in the Red Cross as we look at this increasing pace of disasters is to look at displacement. So why are people displaced? Is there anything we can do before the disaster to keep them from being displaced? If they are displaced, how can we make their displacement better? Post-disaster, how do we get them back? And that goes to those services you had that were offered. Oftentimes we can't get people back to their communities, not because their home is still standing, but the community has been affected by this disaster in a way that they can't get that social services network that they need. This tool helps us kind of map some of that out. And then the final thing is, what do we do about displacement caused poverty? Food insecurity, a lot of those other things come into play here, health services, housing, and all of these tools. The better data we get, the better we can make our decisions, the better we can allocate resources. You know, it's never any one organization, and we have friends we can call, right? We have friends we can call if we see that there is no medical. We have friends we can call if we know this is an area with a lot of small children. Right? Chances are in our shelter, we're going to need people who can help entertain children. If schools are closed, if hospitals are closed, all that information goes into informing what we're doing, and that's really vitally important. The final thing that I'll say is getting that data from all the disparate resources. I love that you called it Meta. It's still Facebook. Facebook and all of those other social medias. There's so many methodologies where people check in or say where they are. And if we can find them, one of the things that the American Red Cross offers after a disaster is financial assistance. And we find, especially in wildfires, if you're evacuated, you're not there, right? We can't go knock on your door and say, hey, we want to help. If you've moved to Aunt Sally's, we can't find you. And oftentimes, or even if you've moved out of the area, the Red Cross assistance is still available, but we can't find people. And so having this tool kind of tracking where people are going or even where people are staying gives us a better target for where we go out with our assistance, where we go out with our caseworkers. And that is really the exciting thing, is to see this all pulled together. We often sit in the mass care task force room at Cal OES and we're all guessing, right? I think this is where the population is. I think this is where they're going to go. I don't think this is available for people to rely on, and any kind of thing that pulls all that data in one place to help us make better decisions is definitively a win for all of us.
Thank you, Denise. There's a lot to unpack in everything you just said, but I'd like to.
Which is why I never stop talking.
But as you mentioned, you're sitting in the state situation room offices and planning this out with a pretty wide range of partners. I'd like to maybe turn next to our colleague Eric Howard, who's a spatial data scientist, GIS expert for California Office of Emergency Services. And Eric, as you all have a very notably sophisticated GIS capacity in the governor's office, in the Office of Emergency Services, and you've been thinking about these issues for many years now. how are you thinking about data preparedness this year? The kind of data dynamics that Sachet was just reviewing, particularly around healthcare resilience, and where you see kind of the opportunities and the gaps that you're kind of concerned about as you look forward towards what could be a really significant wildfire season this year.
Sure. I mean, I think Denise really kind of like touched on a major issue that we're kind of looking to try to figure out a way to wrangle around, and the tool that you just kind of presented is actually like the way that things are structured regarding around social vulnerability and kind of understanding what those populations are, and kind of like, instead of it just being a lot of the times, you know, when it comes from like looking at mitigation planning and kind of like working through like the state hazard mitigation process, there's a big focus on like understanding social vulnerability, but a lot of the times that information gets distilled down to a single index or score. So like having access to information to be able to like break apart those individual scores and understand the characteristics of the people in the communities that we're serving. You know, having access to that granular information is like really helpful in trying to like speed like forward like the planning and decision making processes. So I'm kind of like in a unique position where, yes, I work for Cal OES and I'm in their GIS team. A lot of the work that we do as part of that team is really kind of trying to compile data from different data sources. We've got a couple of folks on the call today that are from the California Department of Health and Human Services, and they're kind of like one of the major data providers that we tap into and kind of help consolidate information like from them. So it's like we're kind of like, I don't know, for lack of a better term, traffic control through the process of trying to like grab all this information and create specific targeted like dashboards or different data products that help serve things. One of the data sources that we do have a really like kind of unique and special relationship is we collect information from the investor owned utility companies during a public safety power shutoff event. So it's like we're kind of the conduit for the rest of the state agencies and kind of all of our partners as far as information related to PSPS in a GIS format. So we're kind of fortunate to be in that role. But I really do think like kind of looking at the gaps, I do think that detailed demographic information in a way that's like easy to understand to like our decision makers and to the people that are on the ground actually being involved in the emergency response process is really important. And I do think that your tool is like a really good step in the direction for that. And I'm also really kind of interested about the data behind the scenes, especially that kind of data from Meta. So trying to track and target, you know, where populations have shifted during the course of an event, I think it would be really helpful. And if there's any way that we can kind of continue a conversation on, you know, a way for us to maybe like be able to get access to that information and share it out with the rest of the community, that would be great too. Because, you know, we do develop specific tools related to wildfire response that are kind of targeted towards like a particular use case. Like right now, we're currently working on an update for this project. It's a situational awareness tool called Scout that essentially like all the wildland firefighters will have access to and be able to kind of coordinate activities in real time. So, you know, any type of information that we could get that we could feed through that process on a tool that they've been trained and accustomed to would be really great. I don't know, does that answer your question?
Well, it definitely gives us a lot of food for thought, and thank you for the reference on the tools that you're working on for coordination. I think around first response, I think is a very important issue. We've thought about this a lot from the standpoint of coordination, you know, of a broader section of social response actors, from primary healthcare, nonprofits, as well as within the state and county and others. This is obviously a shared responsibility, and data collaboration itself, I think, is a shared responsibility that we need to do a better job of working, you know, across agencies and across researchers and others that have a role to play here. So we really thank you for your efforts, and we'll come back to a lot of these issues in a second.
Okay.
So let me turn then to our good friend and colleague, Joan Casey from Columbia University, who's been looking at a lot of the medical and public health issues that are related to smoke and other kind of consequences of what we're seeing increasingly affecting larger populations as we're exposed to wildfire. And she's really helped us think through a lot of issues over the years about these questions. So I wanted to turn it over to Joan and get your thoughts on kind of the same direction that we were just going through.
Sure. Thanks for having me, and really exciting to see this tool live, because I do think it's a big step. And since I'm an academic, I of course have slides, so I'll just respond briefly here. And so I'm coming from the public health perspective, doing large scale population health research to try to understand how wildfires and other disasters affect health. And so I'll kind of talk about what I think this tool can do for us in that context. So this is basically what we know right now from the public health side. After wildfires, we see increased emergency department visits for cardiovascular disease and respiratory disease. That I would say is basically what we know in a nutshell. There's potentially a whole lot else going on, and to understand those things, we need better information. So are there long-term effects? What other outcomes might be important? Mental health, birth outcomes. Any other outcomes that might be of interest? Are there these vulnerable subpopulations? So I think that's a really exciting part of this tool, is giving researchers better access to who's around these fires. And then what's the best measure of exposure? I mean, Satchit touched on this a little bit. So living near a wildfire is obviously a very stressful experience. Is it also wildfire smoke? We think probably yes. But what else is going on? I was really, it's super interesting to hear all this mobility work that's going on at Red Cross, and to really put that into context, because I do think a big piece of this is displacement, and we have not been able to look at that at all in the public health world. So I was just going, I was going to mention that we've been looking with Kaiser using electronic health record data to look at people using this durable medical equipment and what might happen to them during wildfires. And so we know that these are likely a very vulnerable group, both in these power shutoffs that can be occurring, and also because of underlying disease that can be really exacerbated by wildfire smoke or stress. So we know this is going up, and we know that wildfire PM is important. We know that living close to wildfire boundaries is important. And so, using these types of data combined together is really important, and kind of a new frontier in public health research around these disasters. The one other thing on the tool that would be really interesting, I think, because a lot of these are compounding disasters, the power outages and wildfires together, amplifying health risks. Also really interesting to think about including a temperature surface, because I think when there's also this co-occurring high heat, especially when there's a power outage, we would anticipate much worse outcomes. And so having that also available could be really useful, and probably pretty easy to pull, easy because I don't have to do it, but easy to pull into the tool. And so just to mention kind of what we've seen here are both wildfire PM. So thinking about how smoke could be integrated here, increasing outpatient visits in this population, but then also kind of the reverse. We also see, if you're living close to a wildfire, reduced outpatient visits, which kind of makes sense when we're talking about displacement. So maybe these people aren't able to go visit their clinician in the outpatient setting. But on the contrary, we see increased inpatient cardiorespiratory visits in these people that are living close to the Woolsey fire, for example. So this is all kind of to say it's complicated. And so we need a lot of this information that's linked together. And I think, the fact, and this is just to say, like, these are happening everywhere, and there are a bunch of different types of co-occurring disasters that I think this tool could be applied to beyond wildfires. So thinking on the East Coast about hurricanes or tropical storms could also be I'm sure you're thinking about that, but could be a really helpful addition on that front as well. I'll stop there.
Thank you, Joan. And we 100% agree on co-occurring disasters and the need to extend this kind of data integration and analysis model out to the kind of full multi-hazard scope as you described. I wanted to maybe get Sachit's thoughts as we're kind of thinking across a number of the issues that have come up around the role of particulate matter, long-term versus short-term health impacts, the mobility of population, questions around vulnerability, poverty, access to services. There's just been a lot to think about here, and I think this is sort of what we are trying to do with the tool and the research, just to steer this into kind of a useful and pragmatic direction for the response community. So Sachit, what are your thoughts now that sort of thinking about these responses?
No, thanks, Andrew. I'm probably first going to put on a clinician hat and respond to that, and then maybe a CrisisReady data analytic hat thereafter. Just listening to what Joan was talking about and reflecting on, what we face at the Red Cross shelters and in terms of clinical needs, I think it's this black box that's most disturbing that Denise referred to as well. You just don't know what's coming in, and that's very exciting for those of us that go into the emergency medicine until you realize a couple of years of doing it, that's actually quite predictable. But it's not in the case of disasters, right? Because you have no idea what the vulnerability is like. So Hurricane Sandy, people showed up with their medications asking to use a refrigerator in the ER, right? Dialysis folks just show up, and then you have to literally change your clinical pathways about when people get dialysis. And suddenly in an emergency, it is not once in, it's not 3 times a week, but it's based on your potassium and the availability of a dialysis center. And then, Joan referred to this as well. We don't know what that long-term impact looks like, right? What happens when you miss 3 chemo sessions? How do you measure that? How do you measure sort of the recurrence? And then, of course, the intersectionality of all this. Do you not have access because you moved? Do you not have access because your hospital went down? And how do you think through this? Of course, we're not going to attempt to boil the ocean here, and we're chipping away at sort of very specific questions on this journey. One of the things we alluded to but didn't talk more about on this panel that we have in the past, and this is in response to Eric's question about the Facebook data. And Joan's been working on this for a long time, is the veracity of these data. Who are we counting? Who are we not counting? The biases, the uncertainty. So suddenly it's not even as simple as layering all these data onto a dashboard. Each of them has its own sort of geospatial temporal unit that it is tagged to, and the representativeness of each of these layers is so different. If you remember, even on the dashboard, when I was trying to show where the DME users were, we had to switch from places to counties, right? So there is a tremendous amount of work around the data and the methods preparedness that has to be done. So I think that's where the thinking on our team, as you know, Andrew, is to sort of what's next. I think in the immediate in the coming weeks, what we want to do is pause here before we keep building this on and adding layers and literally working with agencies like the partners that are on this panel to say, how is this helpful? How does it speak to something you're building? Can this be incorporated into your preparedness exercises? What's missing, what's not? That's sort of where our thinking is. I do see, Andrew, that Denise has her hand raised.
Yeah, one other thing that Joan kind of sparked in me that I see in this tool that I think is going to be something we're going to have to deal with more and more is going to be where the previous fires were. Some of these folks are repetitively being affected, and that affects a whole host of things. That affects their willingness to evacuate. You evacuate once and it turns out you didn't really need to, and you're less likely to evacuate the second time. There is also a disaster mental health kind of aspect to this. just the smoke in the air, if you were evacuated or if you lost your home, is a level of trauma to folks. And so some of those things are things that I think we should also be looking at, is pull up where were the previous fires, who are the people who have been through this. I like the idea of us sharing data back and forth. One of the things that we use as a big indicator of what's going on is our call center data. Who calls 1-800 Red Cross? And if you see an evacuated area where there is a big gap and nobody's calling, that might lead you to some things. Do they not have cell service? Do they not have power? Or did everybody leave, right? And so I think, we can share data back and forth better than we do right now. And for me, that's the future, is where we're all sharing this data and using these models and making them better. Facebook might not tell us everything. If there's no internet, nobody's checking in, or where they're checking in from, right? Apparently everybody went over here. We know that part, but we also have to look at the silences and the little black holes, right? What is that story that's telling us? And then we work really closely with CAL FIRE and with our counties on the actual damage assessment data. That also is going to tell us information. So the quicker that we can share that data and get that loaded, a lot of California counties share their data publicly. People can look up and see if their home's destroyed. Once they're willing to get to that point, which normally means they've let the community know, getting that data in there too helps us drive the decisions that we make.
Absolutely. Kind of thinking about this issue of data sharing, we often think about it as data translation, so that there's a way to connect, data science and the analytical results with a range of folks that need access to those results, not just data, but insights off of that data. And that's a networking question. I mean, Eric, as we've been talking, with various actors across the state, there's a wide variance in capacity across the state, between counties, between different actors, in the different aspects of the health system, even between primary care, hospital emergency responders. How are you thinking at the state about that capacity variance and ways that we can sort of do better at sort of linking insights with those that need them, and then improving those capacities potentially, so that we have more of a shared response capacity?
Yeah, thank you, Andrew. I'm glad you brought this up, because this is something that's like near and dear to my heart. Definitely. We're kind of like in a unique situation where, like, kind of getting back to like the planning process around like the state hazard mitigation plan and then the corresponding local hazard mitigations plans. We're kind of starting the process of, instead of just thinking about the plan as a document to kind of help drive decisions, of actually creating an online hub repository, which will be able to be which we'll make available to those local communities. It's something we're kind of working on now. So at least we'll have a source of information regarding hazards and risk, and other corresponding data sets too that feed into those local hazard mitigation plans, like to make it accessible to them. And we're having a lot of ongoing conversations about how do we like coordinate and collaborate between the state and the counties, and trying to figure out a way for us to, provide a mechanism for the counties to be able to access the information that we have available, and for them to be able to provide updates and kind of sync with us. So it's something that we're kind of working on now. I just started back at CalOES back in September, and since then we've actually started to grow our team quite a bit. So we're kind of looking to build capacity in-house to help facilitate those kind of conversations. I think one thing that we're doing now, which is kind of like a really like positive use case of this kind of collaboration, is we're coordinating with a lot of the local counties to publish out like a statewide evacuation zones layer. So that way it's just kind of like one statewide snapshot that different county emergency managers or local law enforcement or whoever's kind of responsible for managing evacuations in that county can contribute the information, and actually, then we can share it out with a larger audience and with our folks at OES, and then with our state partners too. So it's been a kind of a good example, I think, of like where we're looking to head as far as like having that kind of state to local connections.
Outstanding. I mean, it relates even to this question that Robert, in a way, from the data point of view, that Robert Fishkin posed in the chat around health and human vulnerability data sources, that expand out from what we've been talking about thus far around stroke, asthma, and other health impacts. Joan, as you've sort of encountered a lot of these sort of intersecting health risks, I mean, what is the sort of data landscape in terms of availability for this kind of work, both from a research standpoint and from a response standpoint, since these are often, some of the most difficult data to deal with publicly?
Yeah, so I'm glad that you separated those two things, because I think the response standpoint is really challenging, because real-time health data to date is not really available unless you're within a specific health system. So, the Kaisers of the world can relatively quickly track their patient population, although they don't have a specific office dedicated to disaster response. Sutter has something similar, especially after the Northern California evacuations of Sutter hospitals a few years back. I think a bit of a step up there. But thinking statewide for accessibility to these types of health data in real time, this infrastructure does not exist. The data generally appear a couple years later when it goes through the California Department of Public Health, and you can request records. Anyone can request them, publicly available data, after filling out a lot of paperwork. But that's 2 or 3 years down the line. And so when we're talking about disaster response, that's not the right time frame. So this is an issue, but I do think health systems are starting to listen more and more. And I think this framing around helping them prepare for incoming patients and who to expect to show up, like Sasha was talking about, it is probably the right angle to get engagement.
Andrew, if I could jump in. The clinical data is probably, much farther down, just bed capacity too, right? Even during COVID, most cities in the United States, including some of our largest cities with, lots of hospitals, New York City, struggle to make live bed capacity data available, right? Total capacity is really not helpful given how saturated all our nursing homes and hospitals are at all times. And like Joan said, the infrastructure it doesn't exist, but it doesn't exist in the sense that I think the regulatory and the policy levers don't exist technologically. Technically, I think our infrastructure exists, and sort of do we begin by negotiating conditional access, right? Similar to some of these large data sets we get from data brokers, including Facebook data, where when there's a disaster, they start aggregating and anonymizing and sharing these data, and then it toggles off at some point. And is that an entry point where academics and response agencies can come together and negotiate with these large hospital systems? We don't, we're not trying to peek into your business. We don't need to know live bed capacity every single time, but can we have the infrastructure in place ready where you can toggle on during a disaster, right? And that's the kind of stuff that we've advocated for, but that also does need regulation to make happen.
For sure, and I think one of the things that would be a kind of frontier for thinking about the data preparedness in the wildfire space in particular is about ways that we can learn from the privacy experience and the data sharing experience with large-scale private data sets into areas that have obviously very significant privacy concerns, even greater, but which have a sort of imperative towards how we can use data from the health systems to be able to target high pockets of need and think in a really proactive way about where you're going to see the greatest medical impacts at several different removes, short to longer term. I'm mindful that we have a lot of folks that are in the audience here that are actually thinking about a lot of these issues, both from the standpoint of the, as Eric mentioned, the Health and Human Services Department in the state, from the primary care level. And I would like to encourage folks that have questions or, as you've been kind of thinking through this conversation, ways that you might like to engage the speakers here. Please feel free to put either your questions in the chat or to raise your hand and come off mute, and we can bring you into the conversation if that's helpful.
While we're waiting for that, one of the other things that I think it's worth noting is that, like so often, California is kind of leading the way. They've been the first wave of this. So I've spent the past, since 2015, telling everybody at the Red Cross, the future is now. Climate change is here in California, but it's moving up to Oregon. We're seeing it in Idaho and Washington and Colorado, New Mexico and Arizona right now. And part of that is to be able to take some of the knowledge that we've unfortunately built in California for the past few years, translate it into a tool, but we have to explain to those other areas how this data plays out and how this affects them. And I think we can be the leaders coming out of California just because we've been in it for so much time. We're having those conversations in the Red Cross because we're across the United States, but I think more and more tools like this will help us tell the story of what happened, which can inform the story of what is happening right now. I often call, so when the Colorado fires happen, that team is used to responding to floods and tornadoes, and sometimes part of that same division has hurricanes. And, I immediately wrote them and said, you're not going to do mobile feeding. They evacuated. There's nobody there to do mobile feeding. Don't do your normal operations, because we've learned that you're not going to need to do that. I think this tool and these partnerships will help us inform. You're going to see these type of needs. For a hurricane, people do often bring their medicines, and they do often they don't leave their walkers and their canes and all of those things behind that we see happen in a wildfire with an immediate evacuation. And so, I really like the idea of this group coming together, but I also think that we're going to need to go out and kind of preach. This is what happened. Let us walk you through it. It's coming your way.
Absolutely. I mean, I think your warning is wise to be heeded. That we're talking about rapid change in what we understand the baseline to be for many of these factors. And I think this is in some cases the hardest thing for people and communities to grasp, is that when the baseline has shifted, the expectations of what a crisis will be is itself a much wider bandwidth. So that's quite important to think about. I mean, when we think about then maybe challenges to doing this kind of work and incorporating novel data sources, more data sources, integrated data sources, research into a lot of this response work, where would we all kind of flag the challenges that are most significant and that we have some ability to make some headway on here? Is it actually just data, data literacy, other dimensions of this that we need to make an impact on?
Yeah, and I'll jump in real quick. One of the things that we saw with the 2020 wildfires in Oregon and Washington and Idaho and Montana, everybody caught on fire that year, but is there isn't not just the data literacy, but there isn't the organizational structure to gather the data. CAL FIRE is very sophisticated in their reporting and the data that they gather. Cal OES is out there. That you've got these agencies that are a little more robust. The west side of Oregon never thought they were going to catch on fire. And so when they did catch on fire, just tracking where the fires were, just getting it mobilized across the entire state. The entire state caught on fire, right? And so we didn't have that level of not just data literacy, but disaster literacy. That was the biggest disaster they've ever seen. They do not have a big, robust emergency management at the state. And all of those pieces play into what you can see is going on and the information coming in. Some of that is explaining to them, you know, here's the information you want to gather, right? But a lot of it is bringing information to them. They didn't do the damage assessment. We got local volunteers to go out and do the damage assessment and then share that with the state, which is in some ways for California backwards, right? But we do have a big challenge around the sophistication. And I don't mean that they're not sophisticated people. I mean the experience that builds a robust system that can respond. So even when we were first responding, and of course there's a pandemic, which made it more complicated, but when we were first responding, Oregon hadn't really done a big EOC, even an exercise. And so we were running around going, you know, who's going to do this? No, we need to pull everybody together for a meeting. We need a logistics person in the mass care task force. We need somebody from public health in here because all of these issues are going to conflate. And having, you know, kind of a tool that helps everybody understand these are the roads that are closed, these are the roads that are opening, and whatever we can do to help our states that aren't as sophisticated get better prepared for this is really important. And it is a major challenge that we are going to face.
Absolutely.
Wanted to acknowledge what Svetlana has written in the comments, and just wanted to underscore that you know, we're talking about thousands of animals often. I was trying to pull up this report from the National Academies in 2020, you know, that does an assessment of the impact of the wildfires in California, and it is substantial. You know, either Svetlana, as you said, you choose to move with your animals, you choose not to move, or then you have to choose to leave your animals behind. And you know, the response is so different for each of those. And you know, this is an issue that you see across nations, across GDPs as well, and it makes it really hard. So thanks for raising that too. If I may comment there, I think what we are now trying to understand is how do you sort of break a tool like this into its component parts that speak to end users, right? We probably don't want the same data visualization tool to have DME users and pet owners and livestock owners, right? But if we begin to ask not what do we want to know, but what do we want to do with that information, it helps partner with response agencies that are going to do something about problem X, and then stream sort of the data and information that they need to that problem, as much as, you know, we work towards interoperability and data sharing, etc. So I sort of want to acknowledge that there are so many different vantage points here, and probably the way we want to think through it is now identify clients, if you will, right? Again, this is an open source academic exercise. I'm not implying a financial relationship, but sort of a fiduciary responsibility around the use of these data.
Yeah, I mean, maybe that's actually a good way to flag also from your point of view about what do you want to do, and some of the additional data that might be part of next steps to, I noted when you were talking, Joan, you really hit on temperature as kind of one of these missing issues. We think about this as, you know, a smoke inhalation, access to hospitalization and primary care, et cetera. You know, could you maybe talk a little bit towards the end here about, you know, things that you see are kind of data priorities and where we might kind of link that to action?
Sure. Yeah. I think temperature is an important one. It's so interrelated with these other two exposures. I mean, higher temperatures, wildfires are more likely, power outages are more likely, we're drawing on the grid more. And then vulnerable people, we know older adults, kids, more affected by high temperatures. So yeah, trying to pull out some of these threads to link together. And then I think the real-time data piece is also super important, and giving people information as fast as possible. Power outage data, for example, if you want to evacuate, maybe you don't want to evacuate somewhere where the power is also out if you can avoid it, to improve health. Or maybe you can, directing people in, it's almost, yeah, in real time to make these sorts of choices would be, I think, extremely helpful. So from the public health perspective, those are a few things. And then this real-time data also will help us much better understand the relationship between these disasters and health, because like I said, we're at the beginning of understanding the health implications.
Yeah, I completely agree. Thank you. And Eric, I wanted to give you a chance for any final comments, either on any part of what we've been talking about.
Sure. I mean, really, I love the work that's kind of being done, and I do just kind of want to like highlight two things that I think are kind of important to keep in mind. And they're kind of related in a way. We have a lot of conversations because for wildfire response, we end up kind of using a lot of different models and trying to get the information out to folks. And something that has come up a couple of times is really this conversation about how do you represent uncertainty, especially with like you're talking model outputs or like a data source that isn't necessarily the entire population, but a representation of a particular population. So really, how do you quantify that or represent that in a meaningful way to folks who are kind of on the ground? So I think that's like one area that I'm always looking for feedback and advice, and and really like to work on is that uncertainty piece. And then I guess, and kind of related to that is also this idea of kind of just protecting confidentiality and privacy, because it's, that you're dealing with a sample of information for a certain subset, and they like that uncertainty to privacy kind of aspects do kind of play off of each other. So just kind of trying to keep, that privacy protection in mind too. It's important in this kind of work. So just really kind of maintaining those. And if anybody has any ideas or examples of like things that they think they've done well to represent uncertainty, like I'm always looking for examples. I'm always looking for better ways to do things, especially around that front. It's a big topic, and it's a difficult problem to kind of address.
Yes, we will definitely follow up with you on that, but it's a big topic for us too. I wanted to just acknowledge that we have a late guest star, Eric Sergenko from Mariposa County Department of Public Health. Eric, you've been really instrumental in the co-development of this tool and really helping us to think about local issues and data literacy and a number of these other questions around gaps that need to be filled. So I wanted to maybe give you the floor as we get ready to close here for thoughts on the tool, your own kind of issues this year. Please feel free to join us. Thanks.
Yeah, no, apologies for joining late. I will say that it's a really bad idea to host a prom during COVID-19, but that's where I was at this morning, was helping the school district out with outbreak investigation there. And I actually appreciated Eric's comments about uncertainty. As we look at wildland fire behavior and predictability of paths, and then the tool that we've been working on is, how do you use that as a predictive tool to allow you to identify where populations are moving from and to, and identifying the necessary resources. I think that's been the biggest challenge for us. Is we are very jurisdictionally oriented. That is, we build our responses around a county level response, but people don't recognize those boundaries. And so our biggest challenge in the last couple of years haven't been related to fires in Mariposa County, but movement of populations from adjacent or even further away counties seeking resources in Mariposa. And we're not alone in that. And then the other thing that I think, when we've been talking about uncertainties and population movement away from fires, is looking at at-risk populations, not necessarily our hospitals, which I think we've got wired pretty well at this point, and even skilled nursing facilities, but now we're trying to crack the nut on the assisted living facilities where we've got those adults who don't necessarily require skilled nursing, but require assisted living, and then having those people networked into how our populations move. And so that's our concerns in the upcoming fire season, and have been present for a while. And kind of we've ticked the hospital box, working on the SNF box, and then working on the starting really working in depth on the assisted living box. And so those are projects for the upcoming season.
And these are all, I think, key issues, as you pointed out to us many times, for us to be able to incorporate into the health resilience mapper tool as we think about skilled nursing, bed availability, resource reallocation, issues that pertain to mobility and power outage that affect critical infrastructure. All of these things, I think, are front and center for us as we think through what's next. And we're at the end of our time here. I just, I would be remiss if I didn't let Sachin have the last word. So Sachin, please take us home.
Thank you everyone for joining. Please reach out if there are opportunities for us to collaborate with you to test, validate, and improve what we're trying to do here. Several of you have already been helping us for the last 2 years, so thanks again for being here. Bye.
Thank you, everyone. And please be in touch. We'll be in touch with you as we go forward with this, and have a great day.